Rabies is a viral disease of mammals that causes neurologic signs, and it's transmitted by another rabid animal, usually through a bite. It's carried in the saliva of animals that are already infected. And in the United States, the animals that transmit rabies to horses are usually raccoons, skunks, bats, or foxes. The clinical signs of rabies in horses are really quite variable. So in its early stages, it may just cause a lameness or even signs that mimic colic. But as the disease progresses, it causes more clear-cut neurologic signs, including ataxia or incoordination, weakness, oftentimes changes in behavior, which may range from manic behavior to somnolence. It can also cause difficulty in swallowing or eating and other cranial nerve abnormalities. So because of its many different clinical signs, in its early stages, it can mimic other causes of lameness or, like I said earlier, even colic. But as the disease progresses and the signs become more neurologic, then it mimics other neurologic diseases. So things like West Nile virus, Eastern or Western equine encephalitis, equine herpes virus, myeloencephalopathy, even EPM can all look like rabies. Unfortunately, there are no treatment options for rabies. The disease is almost invariably fatal, so the concern becomes early diagnosis and recognition even when the horse is dead, so that people that have come into contact with the horse can get treated appropriately. The risk to a person who's exposed to a rabid horse is really quite low. There are very few incidences where a person has gotten rabies from a large animal species, including horses, although there was a veterinarian a couple of years ago, I think actually in South America, maybe in Brazil, who was affected by rabies after working with cattle and sheep. But because the virus is transmitted usually through bites from rabid animals and horses usually don't bite people, the chances of transmitting from a horse are quite low. It's really important for horse owners to vaccinate their horses against rabies. The vaccine is very protective as long as it's given on a regular schedule as recommended by veterinarians. So it's usually once a year they need to be boosted for rabies. And even if the horse has not been vaccinated, there have been people that have used a post-exposure prophylaxis series of vaccinations when a horse has been not up to date on its vaccines but came into contact with a rabid animal. www.cdc.gov has a fairly good section on rabies, as well as www.aaep.org has some resources regarding rabies vaccination and the disease itself.